NCTV45 Newcastle, The Train.
The Gathering Banquet Center, an event center located at 2552
NCTV45 Newcastle, The Train.
Any event, special and eligible. Call 724-652-1149 and let gatherings. The Gathering Banquet Center, an event center located at 2552
NCTV45 Newcastle, The Train. Ask about their daily specials. See the menu at cranium.com. Well, gives you an abundance of choices with 35 beers on tap and always changing. Their banquet services are always the perfection. The Crane Room located at 3009 Wilmington Road in Shannon Township. Call 724-656. NCTV45 Newcastle, The Train.
Seasons change. When that summer goes in, seasons change. It's ready for you. Seasons change. And when the fall brings
NCTV45 Newcastle, The Train.
Seasons change. When the wind blows and that summer goes in, seasons change. And it's ready. Seasons change. And when the fall seasons change for you. It's seasons change.
NCTV45 Newcastle, The Train. NCTV45 Newcastle, The Train.
Unbelievable, it'll make you hungry and a lot of selection to choose from, including wings. Yes, specials too. Don't monkey around, get to Tony's Lounge. Hello and a very pleasant welcome back. And just in time for the end of April, we have snow in the air. Thank goodness for that. I wouldn't want it any different as we're coming into the summer, let's sit in the house season. I'm being a little sarcastic here. I can't help it. Let's get to what's going on in the total. I'm at a loss on what to call this because it's so screwy. First of all, the new positives. There's 1296. That's what we had today. 1,300 new cases. But they add it to the people. They never drop off the people that got better. Now, I just don't know. I poked some fun on Cooking the Castle. If you haven't watched Cooking the Castle, you definitely should. Okay, I poked some fun, but this is starting to get a little bit beyond that. And here is why, folks. These were the protests yesterday. Okay, and I don't doubt there's more today as people are getting very upset. This is the map where he just basically he got his red crayon and was happy. And here is the latest, greatest map that he has concerning, and I want to put it up like this just so that I'm okay a little bit. That's his latest, greatest map on where the COVID is. Now, let's take a look at his maps, as I do every, I'm getting to feel like Brett Baer playing with the maps. This is so bizarre. Okay, and the reason it is bizarre is because there is the new cases are down. They're saying there's one new case. They played yesterday. There was 60, there was 59, so I just rounded up to 60. Okay, there's 60. In Lawrence County. Now we get zip code driven. 17 in Newcastle. That's what they said yesterday. Elwood City, 16. Now, with that, stop and think a second. Those two numbers haven't changed. I love this little bit here that is Harmony and stretches into Lawrence County. They've had 50 negatives. Let's negatives over in, and they have just a Newcastle address. So as this goes, let's check out in Neshannock. They've had 10. So where are they picking up the other one? The Slippery Rock one has 6. So 16, 17, that's 33, 39, and 10 is 49, and none in any of these other areas. Okay, so we're getting blessed with 10, and we don't know where it's coming from. That's beautiful. And at the county level, just to give you an idea, they have, they're reading 59 in Mercer County. They're 6 in Venango. Here's poor Warren County and McKean. I think they found a squirrel and a groundhog up in McKean County, because now they're saying there are 5 cases and there wasn't before. It makes no sense, folks. Look at the map. And with that is our hilarious, often goofy Secretary of Health, Rachel Levine, who got the job, but whose experience and the degree on paper is kind of lacking. So we gave her a position basically that she didn't really deserve. There were people more qualified. Don't see what it is there. The Department of Agriculture, as they go along, and you know, I'll tell you what, and I don't want to make light of this, but there's really not too much else you can explain with respect to the numbers that they're putting up. There's nobody here that it's not even visible to anybody. We don't have people coughing and sneezing. We don't have, I mean, we have snow. It's stopped. The sun's out. It's 43 degrees. You're either going to bankrupt an already financially strapped area. What are you going to do? Tom Wolf, you made a bad decision. Just face up to it. It's a lot easier that way. And I really hope people remember in November. I really hope that. Because I have a feeling with all the absentee ballots, we're going to have a problem. The Department of Health that was their update. Department of Agriculture outlined updated farm labor requirements, advocates for skilled labor to ensure the food supply. Now, provide farmers with housing for their workforce, be it domestic, migrant, or guest H-2A workers. Now, you're probably asking, what's a guest H-2H worker? Guest H-2A worker. That's somebody that's in this country to work that isn't a citizen. Good thing Donald shut down the immigration from everywhere. It's time to put Americans back to work, not to bring people in to work so that the Americans can stay home. At 2 o'clock, Rachel's supposed to provide us with a live stream. And we'll check out her entertaining self, as she says, and wash your hands for 20 seconds. As you know, that's singing happy birthday twice. I'm tired of hearing it, Rachel. Everybody's washed their hands. Tips for Pennsylvanians receiving stimulus checks. The Department of Banking and Security is providing recommendations for receiving their stimulus checks, known as the Economic Impact Payment, in paper form instead of direct deposit. The payments are part of the CARES Act. The department also reminds licensing of limitations on fees for cashing government checks. Okay, so it is important consumers understand that cashing the check cashing fees, so they can keep their money as possible, said Richard Vogt. Now, they're worried about check cashing fees. Folks, a lot of people are just worried about getting their checks. They'll handle the fee. In more not so good news, and I get this, So please, don't blame Chris Fry. He laid off 30 city employees in order to reduce costs and offset the projected earned income tax shortfall caused by business closures linked to COVID-19. He had to. That little bump, which was the earned income tax credit that allowed us to keep the money, that got gone faster than the folks that had Act 47. And folks, if you don't know what I'm talking about, let me totally explain this to you. The city charges a percentage. Let's just pretend that it's 2%. And the townships charge 1%. The city was able to keep the extra 1%. But hello, since nobody's working in the townships as well as the city, that number has gone way down. So they don't even have the extra money to keep the employees they had. And as the Act 47 clock runs, and Governor Wolf and Rachel keep things going on this course, really crazy. Really crazy. I feel bad for the 30 and I feel bad for Chris Fry, because that was not a fair shake. Barbara Moore, Gina Gorensky, thanks for following NCTV45. And thanks for liking our pages. Human Services announces a study to access the impact of COVID-19 on Pennsylvania child care providers. I got it. It's bad. Sure, because if those parents are going to work, nobody's paying for child care that they can't afford. So the kids are staying home. Need to open up the government here, folks. Need to get back open for business. And my question is when they were going after Donald Trump, and remember he did the immigration, so they found somebody in Seattle or California to block it. You mean we don't have anybody here that says, Governor Wolf, there's a thing called the Bill of Rights, the first 10 ones that are part of the Constitution, like, can't do that? No judge, nobody's taking anybody to court. Okay, that's going to work real good. The Wolf administration urges residents to support local restaurants with carryoutpa.com. No kidding. What do you think we've been saying here, Governor, since this all began back on March 13th? Support those local restaurants. Hey, Greenville, support those local restaurants. Hey, Newcastle, support those local restaurants. And you finally caught on. Today, the Pennsylvania Department of Community and Economic Development Tourism Office engaged Pennsylvanians to support local restaurants by visiting carryoutpa.com a website which offers a comprehensive list of restaurants, takeouts, curbside, and deliveries during the stay at home. And look at this. You click on it, they have a link to beer and wine, who's open and who's hungry. Now, let's see. I'm going to just, and I haven't done this, I put in our zip code, Nulla's, the Snowman, which is closed today over in Portersville, and Firehouse Subs, Butler Crossing. That's what we got there. They listed 3. And if I put a 7 in there, nothing. How about one last try? Let's put a 5. That's brilliant. They list 2. No arguing with that, Governor. That's really going to spur that economy. Just don't know how he does it all the time. And yeah, if you think I'm being a little sarcastic, well, I'm sorry. This morning I said he responded to the letter, and I appreciate that. But he didn't really answer the actual case. President Trump intends to sign an executive order to temporarily suspend immigration, a move he says will help protect the jobs and the country reopen. It is the most dramatic attempt yet to seal the borders through officials say the flow of U.S. has stopped, but during the pandemic. Okay. Several governors are beginning to ease restrictions. And let's see what good old Pat Toomey. Planning for what's next. Oh, Pat, you're tremendous. Because in this whole thing, it doesn't say what they're. I welcomed an opportunity to discuss with the president my views on opening. I have spoken with local officials, Republicans and Democrats from across Pennsylvania, as one thing is clear. There are regions and sectors of our economy that can begin to reopen right now. Would you like to tell Governor Wolf? Happy birthday, David Baranski, Ernie Orelli, Valerie Flora, Dale Cartwright, Angelo Chalala, Sandra Medina, Debbie Blues, Cassandra Wigley, Mark Root, Bubba Kirkwood, Mike Rozai, Evelyn Tripp, and Nicole Vitale. Here's hoping you get that second piece of birthday cake and have that great day. Now, we're going to head on over to sports, and we'll be right back.
The Cedars Restaurant in Newcastle wants you to indulge in the food from their pleasing menu. The Cedars features Mediterranean, pub food, Middle Eastern cuisine, and so much more. They're open every day, 11 a.m. to 10 p.m. Call the Cedars on the east side at 827 Addis Street, Newcastle, 724-658-9543. That's 724-658-9543. baby. Yeah, this is the Big Bopper speaking. Oh, you sweet thing. Do I what? Will I what? Oh, baby, you know what I like. Chantilly lace and a pretty face and a ponytail. There ain't no good enough. True love takes a lot of trying. Oh, I'm crying. Is that good, Ann? Just hang on to what we've got. Let go, girl, we got a lot of love between us. Hang on, hang on, hang on to what we got, to what we got.
Newcastle versus West Day meet at Newcastle. It will be a good time. Bring your friends and support the Canes. Watch them compete in running, throwing, jumping, and hurdles. Don't forget to bring a friend and wear your Newcastle gear and see how good the Canes are on the track and on the field.
This program furnished by Sporting Goods, 23 East Washington Street, Newcastle. Call 724-658-2535.
This program sponsored by Penn Ohio Bottled Water Company. Brian Ches, owner. Call 724-498-4760. Brian would be glad to visit you.
Peppers, mouth-watering fruit, fine dressings, apples, meats. This place looks so familiar. Everyone in Newcastle has to know about it. Yes, it reminds you of when you were growing up, right in downtown Newcastle. Look at those fine lunch meats and ethnic foods. Yes, it's Joseph's.
Hello and welcome back. Here you go, 43 degrees outside. Tom Wolfe letter, and I'll paraphrase. I asked for you to close the schools, businesses, cancel large events, and stay at home in an effort to help keep our friends and neighbors and families and co-workers alive. Grateful for the courage. Hasn't announced when other specific businesses will open. But he just has sent the letter to us today, and that's basically where we're at. Department of Human Services, he wants everybody to know that They're open if there's abuse, but nobody's outside. So unless you have your x-ray vision, I guess that's out. Planet Fitness has Facebook workouts. That's a good thing. Tom Brady got cited for throwing a football. And for once, there might have been enough air in it. I don't know. He extended the stay-home order to May 8th. What that does, that's so bizarre I can't even explain it. Okay, and let's see, as we go through here and really kind of catch up some more, he submits a state plan request to support food and access for students during COVID-19. Now, I don't know how they're going to deliver these. The high school's closed. Unless you have a food truck and people are under overhangs, but everybody doesn't have the high school we have or that facility. That's just crazy. And that takes us through that bizarre thing that's called the Midday News. Let's get to weather. Currently outside, and here you go. 43% humidity, wind speed northwest at 18, gust to the 29 barometer, 29.68, dew point 22, visibility 10 miles, and wind chill 35. Now, let's see what radar looks like. Spotty showers, which even like are snow showers throughout the area. Now, it's interesting because a lot more snow showers than anything else. So let's go to the weather and we'll be back with a wrap-up.
BSB. Big Shot Bobs are the wings for me. 50 flavors, make it right, you see. BSB has sandwiches you have to try. Stop in and you'll know why. Every day of the week you see. Call or stop in to BSB. Big Shot Bobs will be your favorite place, just like me.
Easy Clean Car and Van Wash, where your clean wash is our goal.
Hello and welcome once again to Lawrence County 45 weather, and wow, what a great day yesterday. Sunshine abound, blue sky, and last night's overnight low, partly cloudy, 43. How is your Tuesday looking? Well, folks, I hate to be the bearer of bad news. When you see this, okay, you're going to be happy in that you don't see a lot of rain. However, the national picture shows precipitation building out to our west, which is going to give us one of those days. Last night, 43. Don't think you're going to be climbing up too high today, as showers, thunderstorms, mostly cloudy, high of 47. we're going to be lucky to make it that high, folks. The temperature really isn't going to change. And then as you get to Tuesday night, widespread frost. Partly cloudy, a low of 26. So if that rain is still in certain areas, it'll freeze and you'll have ice. Wednesday night, or Wednesday, going into Wednesday, yeah, the sun's going to come out. Sunny 48 as things dissipate in the morning, which beeps you into Thursday. Now, Wednesday night, mostly cloudy, a low of 38. 50% chance of rain, which means Thursday is your rain day. Mostly cloudy, 62. The rain abounds, 70% chance. Thursday night, cloudy, 45. 60% chance of rain. Friday, mostly cloudy, 62. Still that rain hanging in there, but it should give you some peaks of a bluer sky. But then on Friday night, mostly cloudy, 44. Chance of rain up to 40%. And Saturday, mostly cloudy, 62. Or 58. I'm sorry. And chance of rain, 70%. So the rain continues. And here you go. Showers Saturday night, mostly cloudy, 43. Chance of rain, 60%. Setting you up for Sunday, cloudy, showers, 55, 56 degrees, and a chance of precipitation, 50%. So Thursday, Friday, Saturday, and Sunday, you're getting rain. And if you don't like the rain, I don't know what to tell you, but the good thing is you'll be hovering around 60 degrees. The bad thing is you'll have rain. Now that, as we go here, that was Lawrence County 45 weather. Real quick.
Tuscany Square Restaurant, 3470 Wilmington Road, where old world charm meets today's modern conveniences. You'll enjoy their spacious, comfortable seating, their fresh ingredients that go into making every dish, whether it's pizza or that just right entree. Tuscany Square Restaurant, they're here to serve you. Call 724-654.
Simple elegance in a majestic setting. Yes, right here in downtown Newcastle, minutes away from shopping, seconds from a gas station, and let's not forget pastries, a restaurant, and oh yes, the schools. The majestic for that majestic lifestyle, right in the greatest castle, Newcastle. Come by and take a look.
Hear ye, hear ye. This is your old buddy Ben, speaking for Ben Franklin's Tap Room, Grill, and Bottle Shop for the best ribs and sandwiches and dinners and much, much more. It's Ben Franklin's Tap Room, Grill, and Bottle Shop. Food, beverages. This is a place you want to try, and it's right close by. Hope to see you.
There's more than meets the eye. You gotta give
due to COVID-19. It's important to remember that this increase did not happen overnight, but it is the culmination of our efforts to continue to bring to the public the most accurate data possible. Remember, we are basing decisions on the best way to protect public health, not on a single day's increase or change, but over trends over time. To help you better understand this, we have actually added trend animations to the data section of our website at health.pa.gov. These animations will help you see how the disease has progressed in Pennsylvania. Now here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you are going to come into contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And I'm pleased to answer questions.
Thank you, Secretary. From CBS 21, today Senator Bob Casey said he secured a commitment by the Trump administration to publicly release the names of nursing homes across the country that have cases of COVID-19. Right now, Pennsylvania does not release that information, citing patient privacy. Does this commitment now require the state to release the names of the facilities to the public? And if so, when should we expect this information?
Well, I think that we will strongly consider doing that. We'll have to figure out the right way to do that so that we give the most information to the public, but also protect patient privacy. So we'll be working to look at that over the next number of days.
From WKOK, early antibody testing results in California indicate it's possible that people infected by COVID-19 are 50 to 80 times greater in number than we know. When and where in Pennsylvania do you anticipate antibody testing, and how might similar results impact our mitigation and containment strategy?
Well, so we are working to be able to obtain antibody testing in Pennsylvania. Actually, it is possible to get an antibody test through Quest with a doctor's prescription. But we don't quite know what antibody testing means. We have reviewed that study from California. There are some interesting pieces of information in the study. There are also some concerns in terms of the methods and how it was done and the statistics. So, that's the way science works. The study will come out and we'll analyze it. We, look at other studies and repeat studies, and then we'll decide whether that study was more accurate or other studies would be more accurate. So, we are looking at the different antibody tests. Our state laboratory director was on a webinar yesterday and a conference call with the American Public Public Health Laboratory Association and the CDC to discuss that type of testing. The CDC does have an antibody test, and they are piloting that, basically looking at random blood samples that have been obtained in other states, including in Pennsylvania. So when that study is completed, that will have interesting data too. But we would like our state lab to start to do antibody testing when the testing is available that fits our platforms and it's possible to do. But it's going to be more of a surveillance technique, it does not diagnose COVID-19. The way to diagnose COVID-19 in terms of a laboratory test is with the viral testing that we have available now.
From WNEP, if you recover from COVID-19 after testing positive for it, will you be immune from it in the future, and if so, for how long?
Well, as we've discussed previously, this is a novel or new coronavirus, and so we don't really know the answer to that question. And with many viruses, if you have the virus, so let's say it's chickenpox or something like that, before we had a vaccine for chickenpox, then you would have chickenpox, you would have develop an immune response, and then you would be immune to chickenpox. But there are other viruses where that's that's different. Sometimes the immune response is partial, and sometimes it's not very long-lived. And so we will have to see about what the antibodies mean in terms of COVID-19, whether it doesn't really offer any protection or whether it offers partial protection or full protection, and then how long that protection would last. I know that there are some studies out of South Korea which has looked at that, but again, science takes time, and those studies will be being done, and we'll learn more every day.
From WKOK, can you please speak to testing in Pennsylvania? Where are we in relation to where we are, and what is an adequate level of testing?
Well, we want to expand testing throughout Pennsylvania. We have done a good job doing that. We're one of the top 10 actually in the country, but we're not where we want to be. We want to be able to expand testing even more through our public health laboratory. We want to be able to expand testing through hospitals and health systems. We want more and more testing through Quest and LabCorp. And then we want to do the mass testing. Now, we just this week set up a mass testing site in the Northeast, which started actually yesterday and is continuing to gear up and to do more testing. We might consider testing in other mass testing sites. We also have heard that Rite Aid has started to test, and we would highlight that with a doctor's order, that might be a very good place and a convenient place to get a test. So lots of places to get tests. These are the viral tests that we've been talking about, which are different types of nasal swabs. But we would like to expand it more throughout the state so we can get more information about how many patients have COVID-19.
From WPVI, can you give us a status on the number of ICU beds across the state? How many are occupied? And is there a county that's seeing problems?
So approximately 41% of the intensive care unit beds in Pennsylvania are available. But the question is correct. There are specific areas which are more challenged, and that would specifically be in Philadelphia and in the suburban counties in the southeast. So that is, of course, where we've seen the most cases. And as I've mentioned before, it is the most population-dense area of Pennsylvania, so it's not surprising. And so there are hospitals which are more challenged in the Philadelphia and the southeast area. And actually, we have opened up the alternative care site, at Temple to take care of patients as they convalesce from COVID-19 and to decompress the hospitals. And so throughout the state, we're good on ICU beds, and we're watching the southeast really closely.
From the Bucks County Courier-Times, given that it's common knowledge in public health that congregate facilities have a high risk of spread of communicable illnesses, why was there not more in March to require universal testing of long-term care center staff and residents, prioritizing them for PPE to the same extent as other healthcare workers?
Well, we are prioritizing testing and prioritizing PPE to long-term care living facilities. At the beginning of March, if you remember, we just started to do testing. Our first day, I remember we were excited that we could do 5 tests at our laboratory in Exton. And then later in the week, it was 20 tests. And so we certainly have prioritized the vulnerable population in that type of congregation congregate setting, which includes long-term care living facilities, such as nursing homes and personal care homes and other type facilities. We have also prioritized personal protective equipment to those vulnerable sites as well, and are doing everything we can in terms of our infectious disease consultations, our contract with ECRI for more infectious disease consultations, the courageous work of the National Guard, whatever it takes to try to do the best we can to protect those vulnerable seniors as well as the staff in those settings.
Also from the Bucks County Courier-Times, will the department require universal testing in long-term care centers of all staff and residents now?
So universal testing might not be the best way to do that. Again, we're prioritizing testing symptomatic people. A negative test, if you have no symptoms, only proves that you don't have active virus on that day. It doesn't say what you have the next day or the next day. And so we certainly are not going to be able to test every patient every day or every staff every day. So universal, that type of population-based testing is really more for surveillance. In terms of clinical care, testing every patient once won't really give us the information that we need.
WKOK is asking for you to compare Pennsylvania with other states which have fewer COVID-19 restrictions or other countries with fewer restrictions.
Well, so you know, we have, of course, looked at other states, and there are states that have had more severe restrictions and states that have had less. There are certainly countries that have had more severe restrictions, particularly Italy. You know, the governor has always wanted to take a very science-based, progressive approach in terms of the establishment of those restrictions, and that's the approach that we will take when we start to begin to let people return to work in a progressive, iterative, phased approach, and that's the approach we took from the beginning, and that's the way we'll go now.
From WNEP, on the map that breaks down the number of cases by zip code, what does it mean when the displayed result is positive, redacted, positive cases 1 through 4?
It means there's less than 5 cases in that area. And as we have done with all of our infectious disease reporting, if there's less than 5 cases, we don't report it because we're concerned about patient privacy and confidentiality.
From WTAE and the Pittsburgh Business Times, question about elective surgeries. UPMC appears ready to resume elective surgeries despite your order. What concerns do you have about this, and will your office take any response?
Well, so we have had extensive discussions with UPMC, and I know that there were some emails or PowerPoints, but those were just more for planning, and that's my understanding. I think that we have had conversations with UPMC. They are fully on board in terms of our current order, and we please to work with them as well as hospitals and health systems to be able to allow, if not elective, more urgent procedures when the time is right. But the time is not right yet. But we will continue to have those discussions with hospitals and health systems and with the Hospital Association. As we've been saying, though, this will need to be kind of a slow, progressive approach, and probably would start in areas that are less affected with COVID-19 rather than areas where it is much more epidemic.
What will it take, from the Pittsburgh Business Times, what will it take to loosen the restrictions on elective surgeries and procedures? And do you have a concern that the longer it's in place, that there is a challenge to residents whose care has been delayed? Well, so that is the key, is we have to balance procedures that are necessary versus both the risk of someone being in a hospital setting and potentially contracting COVID-19, because there are patients with COVID-19 there, but also we have to be careful of our very precious resources, such as ICU beds, such as ventilators, but also particularly the personal protective equipment. When you're going to do certain procedures, then you're going to need the surgical masks, and you're going to need gowns and gloves, and we're trying to prioritize those for the areas that are most impacted. But we have worked with the Hospital Association and hospitals. We have had some great health systems actually through their mutual aid
aid agreement, donate resources to affected areas in Philadelphia. I know that that UPMC has done that Penn State Health has done that Geisinger has done that, and others. So we're really pleased by that. We have to prioritize right now the global pandemic of COVID-19. But the other part is true too. And so we're going to be working with the hospitals themselves and the health systems and the hospital association on what that right balance will be, and when sort of more urgent, but not emergency procedures, but urgent procedures can go forward. So we're not there yet, but we're having active discussions.
From Spotlight PA, as of today, a specific type of probable COVID-19 death is being included in the state's official count. That's deaths without known transmission from a confirmed case, and listed on the death certificate. But are there other types of probable death cases that the Department of Health is currently investigating and trying to reconcile into the data that don't yet appear in our official death count?
No, but I want to highlight that this is not unusual. This is the way that infectious disease deaths are usually reported, but we don't usually spend as much time delving into it. Of course, with the global pandemic, COVID-19, we're looking at our data really carefully. We are presenting our data in a really robust, transparent way to the public and the media, and we want to be as specific as we can. But, with our great epidemiologists who are like disease detectives, I mean, this is how they report it usually, according to CDC guidelines, but obviously we're paying much more attention now.
From NBC 10, do you believe that the number of deaths caused by COVID-19 are being underreported, and if so, by how much?
No, I don't think they're being underreported, and especially now that we're able to reconcile our different systems and that we're reporting confirmed deaths and probable deaths. Of course, there is going to be some reconciliation that has to be done with a different time of reporting. So again, we are collecting our information as of 12 midnight. If a city or a county or municipal health department collects their data at 9 a.m. or 10 a.m., there's going to be some discordance. And we talked about the Johns Hopkins data previously. They collect data from many sources, including the media, and so there's bound to be some differences. But we're very confident in our data.
Also from the Scranton Times-Tribune, for the second time in 3 days, the state reported a huge increase in deaths. You've answered some of their questions, but they're asking what is exactly the reconciliation you're talking about, and what are your people checking? What are the new sources of information?
Mm-hmm. So we're not actually, in the last number of days, we're reporting more deaths, but it's not like that many deaths occurred in 24 hours. This is a collection of reports over the last number of weeks. So it's probably better to say that we are reconciling our data. And so in terms of our data sources, we have NEDS, which is the way that hospitals, health systems, nursing homes, etc., report into our system. It's the way that most county and municipal health departments report into our system. Then we also have deaths that are recorded through our Vital Records Office and that electronic data system. And we have deaths being reported from coroners. And so we're working to reconcile all that data and then present it to you. The difference today is that we have added probable deaths in addition to confirmed deaths.
From the Altoona Mirror, the New York Times yesterday had an article written by a doctor that suggested that COVID-19 is sneaky and that it compromises lung function significantly before people feel that they're having trouble breathing. They said that the pulse oximeters that you can buy in a drugstore and use at home would be a good way to provide an early warning, so those who may be infected could seek testing and treatment earlier. This could help minimize cases where people come to the hospital well on the way to needing a ventilator with all the problems that it brings. Do you have any thoughts on this?
Well, I'm not sure I would use the word sneaky. Sneaky has a specific connotation that we would usually use in terms of describing a person in terms of their motivations. COVID-19 is a virus. It doesn't have motivations. It just causes infections, and then it spreads those infections to other people. And some people are very vulnerable to it, as we've said, seniors, etc., and can have serious complications and deaths. But so sneaky wouldn't be the word I would use, but it is complex. It's also new, so we're learning new things about it all the time. So it certainly does cause significant lung damage, particularly in certain patients. And it can cause other organ damage as well. There can be neurological effects, brain effects that can have effects on the kidneys and other organs. So it's a very serious infection for many people. Of course, if you have underlying conditions such as lung disease, such as chronic obstructive pulmonary disease, that's like emphysema or chronic bronchitis, then it can cause even more damage. So measuring oxygen level can be very important. But I think that my feeling is that should be done under a doctor's care. So a doctor might recommend that a patient have a home pulse oximeter that measures oxygen, and then that oximeter is reporting either electronically or maybe by the patient by phone is reporting that data to a doctor who can help them make decisions about whether the patient needs to come in to seek care. I would be concerned about the interpretation by the public without a healthcare provider's monitoring. Of course, that could be a physician, it could be a nurse practitioner or a physician assistant, but I think someone needs to monitor that data to help interpret it and then make the right decisions for that patient.
From News Talk 104.1, yesterday several state lawmakers were present at the protest at the Capitol. Would you suggest that they be tested for COVID-19 as a precaution? And as a follow-up, should anyone that attended be tested? So
as we've been saying before, we don't test asymptomatic people. So right now, I mean, they were there yesterday. The mean incubation period is 5 days, and then it can be up to 2 weeks, but on average around 5 days. So if those individuals start to have, that were at that mass protest, if they did not practice social distancing, if they did shake hands and have other personal contact, if they were not wearing a mask, and in 5 or so days they start to have a fever and cough, then they should contact their healthcare provider. Now, if they're mildly ill, I would presume that they have COVID-19 and they should isolate and rest and watch their symptoms carefully. If they have more severe symptoms, then their healthcare providers should test them, and then they'll seek whatever treatment they need. I had expressed before that my main concern about the protest, which is their democratic right, was that they would not social distance and that they could expose each other to COVID-19. I mean, this included individuals from around the state and actually a number of individuals from other states, and that's how COVID-19 spreads. So I remain concerned about their physical health, and they should watch to see if they develop symptoms really carefully.
From Capitol Wire, though deaths are rising rapidly, it appears today was the first time in quite a bit that hospitalizations at noon were lower than the previous day at noon. While it's only one day, hospitalizations have been slowing both outright and compared to overall positive cases. Would a continued decline in hospitalizations be a signal that the virus is petering out?
Well, so we haven't seen, first, that large of a jump in deaths. We are seeing a different way that we are reporting deaths, first on Sunday and then today. So that explains those changes. But we have been noting the data in terms of hospitalizations, and we watch the trends over time. If there is a continued trend in terms of decrease of hospitalizations, that, of course, would be a really good sign.
From the Citizen's Voice, we've been getting calls from people who want to be tested at the Mohegan Sun site but don't have access to the internet. What can they do to get pre-registered, and can a family member pre-register on their behalf using the website?
So it's a really important point, and I really thank you for bringing it up on a regular basis. So we were not satisfied with the answer that you had to use the internet, and so working with the Pennsylvania Emergency Management Agency under the direction of Director Padfield, we are working with them at the DOH on finding another way that people can register by phone, and we're hoping to have more information later this week. And I do not think it would be a problem if someone registered one of their loved ones, for example, using the internet. But again, we're only testing symptomatic individuals.
And then as a follow-up, the Citizen's Voice is asking, do you think you're truly serving everyone and getting accurate test information if there are people who can't register?
Well, we're going to work to make sure that people without the internet can still register, and we hope to have an answer later this week.
From the Altoona Mirror, an appliance store is complaining that also being shut. I'm sorry, let me start over. A local appliance store is complaining about being shut down, even though Lowe's and Home Depot are open and selling appliances. The store's waiver application, which argued that appliances were an essential product, was denied with no explanation, according to the owner. When you walk into Lowe's, it looks like Black Friday, he said. It's actually insulting. Do you have any comment to that?
So I had very little to do in terms of the waiver process and things like that, so it's hard for me to comment on that. I know that that Lowe's and Home Depot are open so that people can do necessary repairs on their house if the plumbing or something else is broken. So that has been important, and we know why that was included. But I think it brings up a bigger point. We know, and the governor knows that the economy is struggling in this global pandemic of COVID-19 with the mitigation efforts. And we know that people are suffering and businesses are suffering. And so we want to do everything we can to help them. And I know that there are small business loans available through the Department of Community and Economic Development, et cetera. And then that is why the governor announced on May 8th that there'll be aspects of the state that will have that will start to have more of an economic recovery in terms of businesses and jobs. So we're going to, and that, part of that included construction. So more details about all that later, but it is very important that we take those economic considerations, those business considerations and job considerations and balance it with public health. And so under the governor's leadership, we'll be making slow, progressive movements in the future.
From the Observer Reporter, does the department know the percentage of the state's population that has been tested for COVID-19?
I don't have a percentage at my fingertips. We know the number of positive and negative tests that we have. I guess if we know the general population, we could come up with something. But I think the fact is that we need to do more testing, and we realize that. So even though we're in the top 10 of states for testing, we want to do even better than that, and we want to be able to expand testing wherever possible. And I kind of outlined that previously, and we're going to continue all of our efforts to do that. What's challenging is that we need to be able to have the reagents and chemicals for the different aspects of the testing. It's been very challenging to get those, but we will continue to double our efforts to do that.
From the Post-Gazette, why did the state decide to start using probable death reporting now? Is part of it to help the state decide whether or not to begin to reopen business and daily life? And who determines what is a probable case rather than a death?
So a probable case rather than a death. So I think they might mean a probable death versus a confirmed death.
I believe
we'll
so.
Go with that. So, again, this is part of the work of our epidemiologists or our disease investigators or disease detectives. This is how they usually report infectious illnesses. It just has taken time, given the scope of COVID-19, to be able to get to this place that we can do this reporting. And the difference between a confirmed case and a probable case, and again, a confirmed case is a person who has tested positive for COVID-19. A probable case is someone who has symptoms and had a close contact but has not had a test. In terms of confirmed deaths, those are Pennsylvanians who have tragically passed away who have had a positive test for COVID-19. A probable death are those who have died and their death certificate lists COVID-19, but they did not have a positive test.
Our last question today is from the Associated Press. You said that contact tracing will be really important as Pennsylvania begins reopening its economy. Earlier today, Governor Wolf said there's no budget for contact tracing, nor has the Department of Health found the best way to do contact tracing. Can you provide an update on the department's efforts in this area, and will the inability to do contact tracing hamper the state's ability to reopen?
So we will have the ability to do contact tracing, and we are working right now on exactly what that plan would look like, and exactly what type of personnel we would need. And we have received funding from the federal government and the CDC in terms of COVID-19. So I have complete confidence in our disease detectives, led by Dr. Sharon Watkins, who's our state epidemiologist, that we're going to come up with a very robust plan to do contact tracing, which will be a very important part of the future plans.
Thank you, Secretary. For those reporters whose questions we were not able to get to, the Department of Health's press office will follow up with you before the end of the day. Our next briefing will be tomorrow. Thank you so much.
Special thanks going out to Town Mall Pizza for sponsorship of this program, located in the Cascade Galleria, Newcastle.
At our law firm, we see you. Come see us at lgkg.com.
Today's programming is brought to you by NCTV45 and NC Radio 450, Newcastle's community television station.
And there you have it from Dr. Rachel Levine, Secretary of Health in Pennsylvania. And she mentioned a couple things. The masks, not required. Also, that, how did we put it? And I put also, oh, you didn't have to wear a mask if you went outside, she said, and then I also typed that it's also your democratic right to leave your house. Big business over small business, that's a constitutional issue. You can't favor one over the other. And basically, some of this stuff is not legal, and now they got probable deaths figured into the deaths, so therefore inflating the numbers and throwing that off. So if you haven't watched in its entirety, please do so, and make sure that you tune in to NCTV45. We're available anytime on your time. Now tell a friend, and have a friend tell a friend about NCTV45. They'll be glad you did. And when they say, oh, I don't watch a lot of TV, you tell them that NCTV45 is available anytime on your time. Yes, a train that runs on your schedule, that's NCTV45. Broadcasting right here in Newcastle, Pennsylvania. So as we leave you, it's downtown train, and make sure that you get that second cup of coffee as I bring it up there, and have a super day in what I call the greatest castle in the world, in the county of Lawrence. Have a great day, everybody, and we'll see you again real soon.
The window and down to the street, I'm shining like a new dime. The downtown trains are full